Knock, knock, knock.
Yes, hi.
Hello, Ina. My name is Alexander Stroing. I'm a student of physical therapy program at Stanford University, and I would like to work today with you. Is okay?
Yeah.
Ina, can I have your full name and date of birth?
Yeah. Ina Dubominska, August 12, 1958.
Awesome. And with my understanding, what you brought here is exacerbation of the COPD symptoms that occurred 3 weeks ago, right?
That's correct.
Okay. So I just want to let you know, you have a gold stage 2 COPD, which means you have moderate amount of airflow obstruction. So COPD is obstructive lung disease, and so the main problem is getting air out of your lungs. When you cannot completely exhale, some air still remain trapped inside, which is increased work of breathing and can contribute to simple shortness of breath. I checked your vitals at rest, and I noted your blood pressure is 136/82. I would say it's a hypertension stage type 1, so we have to discuss about that a little bit later. Then your heart rate is 78, it's normal, and respiratory rate 20 rate per minute, it's also with normal limit, and oxygenation of the blood is 94%. It's also with normal limit. And obviously I don't see any shortness of breath at rest, so that's good. All right, your major goal to improve your activity of daily living would reduce symptoms of shortness of breath, dyspnea, right? So auscultation shows you have a reduced sound in your both lungs on both sides, without crackles, without whistling, or without any abnormal sound that make me think you might have mucus or fluid inside your lungs, and maybe we need to use technique to clean them, right, to clear it up. Not in your case. In your case, reduced sound means your ear is coming in, but because it's trapped, it's not getting out. That's all. Okay. So my goal is for today to teach you purse lip technique breathing. So basically, when you breathe in, and you kind of take it 2 seconds, and when you purse your lip and think about you wanna breathe out a little bit longer, like 4 seconds, and that's what's going to help you. That basically inside your lungs will create artificial pressure. They will help you to get your air slowly out. Okay. And paced breathing, it's when you do activity, try to pick up something or going up the stairs. An easy part, you will, for example, sit to stand, you will do breathe in when you lean forward, right? And when you push yourself out, you're gonna do breathe out. But also use pursed lip breathing technique. So for example, at rest, how I breathe, right? Pursed lip technique, you purse your lips, and with your nose you breathe in for 2 seconds, and then you breathe out for 4 seconds. Again, you breathe in with your nose and purse your lip and breathe out for 4 seconds. Try to do it multiple times. That's very good. One more time. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. Good job. Sometimes when you have already reduced also muscles work, and plus you have symptoms, and if you feel that it's difficult for you to do pursed lipping, sometimes you can use tripod position like this. Just put your elbow on your knee, right, and do it same thing, pursed lipping technique. So breathe in, breathe in, and longer breathe out. Okay. All right, next one. Again, when you try to do sit to stand, you report you have a shortness of breath. Again, what we're going to do is a paced breathing. When you try sit to stand, you lean forward on the easy part, you breathe in with your nose, and then you push yourself up with breathing out through your pursed lips. Okay, so it's going to look like this. Again, lean forward, breathe in, push, breathe out. All right, let's try. Lean forward, breathe in, and push yourself up. breathe out. Very good. And when you sit down again, you breathe in. When you sit down, breathe out. Good job. Take a rest, breathe in, breathe out, and repeat. Very good. How do you feel? Do you feel shortness of breath?
No.
So a little bit easier to breathe, right?
Mm-hmm.
Very good. Let's go sit down, take a break. When patient perform exercise, it's a good idea to ask how's the patient doing. If the patient report dizziness, shortness of breath, or maybe you see face become pale, it's a good indication. It's a good idea to take patient in sitting position to the chair to relax, take a break for 5 minutes, and use your heart rate, blood pressure, oxygen, respiratory rate, all those major vital signs, because we're doing before, during, and after the therapy. If within 5 minutes you see hemodynamics response stable, so blood pressure doesn't have abnormal signs, respiratory rate, oxygen rate is fine, then just let patient's symptoms like shortness of breath maybe just reduce with proper technique, and then continue. If the patient continue and don't feel well, you can terminate therapy. And if the patient show abnormal hemodynamic response, you can also call 911. Okay, so right now I basically will perform vital signs. Just make sure we're doing all right. Just put it in. Oxygen rate 97-75 beat per minute. Very good. You can put your hands on my shoulder. Over 82. It's very close to what you had before therapy start, so we are doing good so far. Let's just confirm. So you have a 66 beat per minute. What I did, I count for 30 seconds your heart rate manually. There was 33, and then I checked your respiratory rate, which is 9 by 2, in 30 seconds it's 18. It's also with normality. All right, so all your vital signs tell me we can continue, okay? And next one we're gonna do is walking. So I want you to stand up with some technique, breathe in with your nose, breathe out with your mouth. Good. So when you walk, just remember, breathe in with your nose in 2 seconds and try to breathe out a little bit longer. Use your pursed lip technique for 4 seconds, okay? And when you walk, I'm gonna show you, walk like this. Breathe in, and then breathe out. Breathe in, breathe out, all right? Let's go. Very good. How do you feel?
Good.
All right, let's go sit down. I think you did a great job today. We improved your symptoms, and you, generally speaking, feel a lot better. So I think we are in a good path, and next time when you come back, we'll repeat and see how you're doing. Do you have any question for me?
No, I'm good.
All right, Ina, thank you for coming today, okay?
Thank you.
Bye-bye.